Okay, thank you. Okay, so I hope you can hear me well. So I'm ending this session, so like Professor Gross said, I'm between you and your coffee break, so I'll really try to be brief and skip the things that I'm sure everybody here already knows. So I will talk about clinical aspects. I'm a child and adolescent psychiatrist. I work in Gap Mental Health Center, actually in the outpatient clinic, but this work relates to a study we conducted in inpatient ward, in a closed psychiatric inpatient adolescent ward. So I want to thank, there were some other collaborators, but mainly I wanted to thank Professor Avi Weitzman and Dr. Ran Barzilai. Psychiatric admissions of children and adolescents with autism, with or without intellectual disability, are not rare, but still very challenging. Children with ASD are 6 times more likely to be admitted to a psychiatric hospital than typically developing children. And in one survey of psychiatric admissions among youth with ASD under the age of 21, found that 11% were reported by their parents as having been admitted at least once. The one-year prevalence of psychiatric admission among children with ASD is between 1.3 to 7%. Specialized psychiatric units for patients with ASD or other neurodevelopmental disorders are scarce, only 2 such units in Israel. Moreover, despite the relatively high admission rates in this population, there is little published data about demographic and clinical characteristics of these admitted patients. People with ASD have higher rates of comorbid psychopathology than their non-ASD peers, but it is harder to detect the comorbid diagnosis in ASD due to their less efficient communication skills, as we all know, as well as intellectual disability in some patients. The rate of comorbidity among pediatric ASD population is debated a lot, and it ranges, but some studies shown up to 70% of comorbidities.